So a retinol is a vitamin A molecule, and a retinoid, which a dermatologist can prescribe, is a retinol related molecule. And a retinoid is often much stronger than a retinol, but a retinol is still an amazing ingredient. That's probably the best topical ingredient that we have in skincare. Um, Retinol is a very small molecule that absorbs into the epidermis and stimulates the keratinocytes, which are the skin cells, to um, turn over a little bit more healthily and a little more rapidly. And because it does that, it stimulates um, kind of a thicker, healthier epidermis. It causes more skin tone turnover so that your pores are not getting occluded with sticky, dead skin. It's turning over faster so that your pores are getting cleared out. Any hyperpigmentation that you have, where your melanocytes will deposit melanin granules in your keratinocytes with sun exposure, are going to get shed faster, so it reduces hyperpigmentation. So retinol is an amazing ingredient that causes a lot of really good anti-aging properties. It also stimulates it, so it goes into the nucleus of the cell and changes the way the cells are programmed to kind of behave in a healthier, sort of more youthful way. It helps prevent wrinkles, helps prevent sun damage, helps with kind of regenerative processes in the skin. It can only be used at night because it's not a very sturdy molecule, and it can be inactivated by UV light. So we always recommend using retinol at night. But nighttime is a perfect time to use it because retinol is going to stimulate those regenerative properties that happen at night anyway. You actually have retinol, which is vitamin A, floating in your bloodstream as it is. It goes into the dermal vessels and then is absorbed by the skin cells in the epidermis from the dermal blood vessels. So you're getting retinol from your bloodstream anyway, and then applying it to the skin also gives you absorption from the other direction. And you really can't have too much of it as long as you're not getting irritated. So retinol can be very irritating. So this product encapsulates the retinol, which allows better absorption without irritation. It's in an oil base. Retinol is a fat-soluble molecule, so an oil base typically works better for it. And the oil acts as its own sort of moisturizer. So when you combine retinol with moisturizer, you're much less likely to get red and peely, which can happen when you first start using retinol. With any retinols or retinoids, I always recommend to patients to start slowly, twice a week at night, and then you slowly build up to 3 times a week, 4 times a week, 5 times a week, until you can tolerate it every night. Some people will start using it every single night and notice that their skin is a little bit red and peely, and then feel like, oh, it's too irritating for them, they have an allergy, but they don't. Eventually, your skin will get used to retinol. You just have to go really slowly. And so if you get red and peely from it, you just stop for a few days, let the skin recover, and then restart slowly. Beth asked if the product is good for skin brightening. For sure. So skin dullness can come from, I think of it, as being from 2 different things. One is kind of sticky dead skin cells that don't exfoliate well from the stratum corneum, causing sort of like a dull texture and reduced shine. And then the other one is from little spots of hyperpigmentation, like little tan sunspots and freckles that you get from sun damage. So retinol addresses both of those things because retinol causes increased, healthier turnover of the skin that's going to prevent the stratum corneum from holding on and staying sticky and dead, causing like little dull and scaly patches on the skin. So that reduces the dullness in that way. And then it also turns over the cells faster. And so a lot of the cells that have too much pigmentation from sun exposure are going to shed. And so you get reduced hyperpigmentation as well. So in both of those ways, retinol would be considered brightening. Retinol is really like almost a panacea in dermatology because it really is a very effective and does a lot. Brightening, kind of enhanced skin turnover, anti-aging, anti-wrinkle, anti-sun damage. So it's really something that most people would benefit from using at night. With rosacea prone skin, you have to be careful with a retinoid. A retinoid is a much stronger version of retinol that's prescription. But with something like this product, which is oil-based, lower potency retinol that's encapsulated, it should be gentle enough for sensitive skin. So you can use a product like this. So if somebody has rosacea or sensitive skin, I will direct people to using an over-the-counter retinol that often has combined hydrators like an oil in order to help help the tolerability of it. So I think I'll go on to the final product, which is this one here, which is called the Alpha